God bless you and good evening. It is your coach and colleague, Dr. Brenda Bowers, here with the Because We Are in the World update on Thursday, April 2nd, 2020. I am coming to you as hopefully a knowledgeable individual in the area of healthcare, in the area of change and transition. My PhD doctoral work is certainly in change and transition leadership, executive leadership in particular, in a healthcare setting that is undergoing systemic change, as well as I do have my doctorate in nursing practice, and I have been practicing in the healthcare field for over 3 decades. So as I look at the information, it not only intrigues me and interests me, it compels me to share what I am and what God has blessed me with to turn around and bless others. The only reason I'm where I'm at is because someone took time to pour into me. So that is my desire when I'm doing these and any type of update. Because we are in the world but not of the world, we still need to know how to manage ourselves in the world, even though we're from the kingdom of heaven, and anticipate going back to be with the Lord and be with Him forever and ever. That is our goal. But right now, in this world, we're dealing with a couple of things. And one of those things is COVID-19, or the novel coronavirus. This virus that has its name because it has little spikes on it. It looks like little crowns, and those little crowns, as the virus is so small we can't see it with the naked eye. But what happens with this virus is it gets latched on typically into our respiratory system, and then once it's in the respiratory system, it's really hard to snatch that virus off, because unlike a bacterial infection where we can take an antibiotic and get rid of it, a viral infection does not respond to antibiotics. Some respond to antiviral. That's why the flu vaccine changes every year, is because it's never a one and done. We're always trying to contend with the strain of virus that we're being presented with in that particular year. This year, we not only are dealing with the influenza virus, but we're also now looking at what has been deemed a pandemic, in other words, an outbreak that is affecting and impacting multiple parts of the globe at the same time, and creating an alarm based on mortality. Now we're in a pandemic with not the influenza flu, even though those numbers are much larger. We're seeing a more aggressive virus in the novel coronavirus known as COVID-19. So just a couple of updates. Yesterday in Wisconsin was the largest one-day case increase of positive tests in Wisconsin. It had 1,600 positives and 18,000 negatives, with a reporting of 33 deaths. That is not at a state level. That's at a state level, and the state level it fluctuates up and down, and we know that if we're going to reconcile data, our source of truth is always that that's closest to the incident. So municipalities, and then county, and then state. The other thing that changed yesterday is the number hospitalized increased, but it was our first time of really looking at number of individuals at a percentage of the positives that were in the hospital. So we'll look at that number again today. One of the other reasons that we're having a larger reported number is because we're testing more. We had not had a large number of tests, so as tests become more readily available, we would anticipate that we would see a higher number of some type of result, preferably negative, but we know also positives. So today, state of Wisconsin is recording 20,317 negative cases, 1,730 positive cases or confirmed COVID-19 cases in the state, which means a total of 21,047 individuals have been tested. So we're getting a lot more tests done and completed, which is a good thing. The state today is showing 31 deaths. That's why I told you that's a fluctuating number. We have to look at the county and municipality data in order to be totally on point with that. The state is also reporting 461 hospitalized. Since of that, 1,730 that are positive. Excuse me. Of that 1,730 that are positive in the state, 461 have been hospitalized, or 27%. And that's the number positive against the number hospitalized, that percentage. Now, Milwaukee County for today, as I always tell you and show you, it is showing 918 positives, and Milwaukee County is showing a total of 18 deaths. The municipality of Milwaukee has confirmed cases that have increased again today to 722. And as you look at the data, once again, it's going to prove that we haven't started doing that. We haven't peaked and started coming down. So we are still going up. And we're ready for that curve to change. So let's look at this county data real quick. So there we go, Milwaukee County. You see the 918 confirmed. You see the 18 deaths. You can also see on the left the Milwaukee number, bottom left. And you see what I mean, that we're not turning down yet, because in the bottom right, you see that we're still going up. And you see that age stratification, a little more of an even distribution today. We're starting to see the ages that are impacted actually start to change. So we want to keep an eye on that as we continue to look at this daily data. Now, I also am going to show you our trusted Johns Hopkins colleagues. I just love how they are providing the world, not just the United States, with a dashboard. And you can do a whole lot with this dashboard. I always just show it to you like it's a still picture, but it really isn't. It is an interactive dashboard, meaning that you can push buttons and find out information. But let me show you what it looks like today. So from Johns Hopkins, updated, you see in the bottom left corner, today at 5:21 p.m. is when this data was uploaded. So what do we see now? We see now that we're over 1 million confirmed cases around the world, and we see that the United States has 242,182 of those confirmed cases. So now remember, as we do more testing, we expect to see more cases. These again are reportables, and we know that in every disease state there is a percentage of non-reportables. And we do see the total number of deaths globally, 52,863, and total recovered, because I love that they provide that for us as well, which is 210,186 individuals. Now the total deaths I would show you, like, and in the United States there's this number of deaths, but what their dashboard actually does is they show each state. So if you go to the dashboard, you can scroll and you can see each state versus that roll up for the United States. And then in the bottom right corner, you see that trending is still going up. So even on a global level, we are not seeing a peak that's starting to turn down yet. And at the bottom, we see that we are reporting. So what are they reporting? What is all that red in the middle compiled of? It's compiled from 181 different countries or regions. So as we look at what is going on, what do we need to do? What do we need to do the same? What do we need to do different? I did look to see if the state of Wisconsin was telling us anything really different. So I'll just tell you, I'm just going to read quickly for you what they're saying as it relates to you are safer at home, and we know that. So Governor Evers is saying our number one goal is to ensure that the healthcare system has more beds, more frontline healthcare workers, and critical care capacity than the number of people who will become severely ill and need them. So that is the number one focus of the state of Wisconsin, is to make sure that we have enough hospital beds, and then that we have enough people to work that are trained to give the proper care that's needed for those individuals once they get in those beds. And many of those individuals, remember, what happens is individuals who are impacted by this virus tend to do pretty good until they're about at that 2-week state, and then it turns respiratory. And when they start what is described, people are saying, I can't breathe, I can't get air. When they get to that point, then it looks like there's about a 24-hour period window that we have to turn that situation around, and that's when it gets really hard to turn around. And many individuals are being intubated, put on life support to the degree that we have the equipment available. So we always want to make sure that there's enough equipment available. So that's what our governor is asking for, not just for workers, but to make sure that we have bed capacity to manage the individuals that become positive and symptomatic, and not just for COVID-19. Basically, what we see, individuals who do end up losing the battle with COVID-19 is because of respiratory complications. So being in the world but not of the world, I'm giving you also some direction to be praying about. The second point that the governor says is our collective efforts through Safer at Home are designed to help us accomplish our goal by flattening the curve and slowing the spread of COVID-19 in Wisconsin. People have been talking about flattening the curve, and some of you have asked me, what is the curve? What are we trying to flatten? That doesn't make sense. So that is where I show you, whether it's Milwaukee County data, global data, where it looks like everything's increasing, and we want it to stop increasing and start coming down. So how do we flatten that curve? What we would like to see is, if we're this high, let's start getting like this, versus we got to go this high like this. So we're here, and we need to flatten this curve. So we're getting more people tested, less people dying, and we need to get on top of this. So that's when you hear that, that's what it is referring to. Third point, assuming that we are all implementing Safer at Home well, it will likely be several weeks before we are able to start to see results. So the other thing the governor is asking us to do is to be patient, because it's not going to happen overnight in an instant. This is something that's happening over time, and it is important for all of us to practice our Safer at Home so that in the next few weeks we're able to see some results. And yes, a few weeks does mean after Easter and deeper into spring. And his next point, that is because of the lag time between infection, symptom onset, test results, all those numbers that I've shared with you today, in the near term are people who were infected before we started Safer at Home. So what the governor is saying there is, the numbers that I'm giving you, most of those positives ended up in place before Safer at Home was put in place. So what our belief is that if we all are good citizens and practice Safer at Home, then we will be able to stop the increase, because of the mass majority of the number infected probably were infected before Safer at Home. So if we're all doing Safer at Home, then that should mean that less people ultimately become infected, and at the end of the day, we have beat this virus. Two more points that the governor made today. The science and the data tell us that staying at home is effective. Please don't get discouraged. We need to remain vigilant and continue to do everything we can together to stop the spread of COVID-19. Last point, keeping our healthcare systems from becoming overwhelmed so it can care for us during this epidemic is our number one priority. The more we all stay safer at home, the sooner we can get through the worst of this. So that is the message from the leader of our state. As good citizens, Vessels of Honor Christian Church, We are abiding by the safer at home guidelines. We're asking that each of you do. We do have individuals that will go get your medication for you, that will grocery shop for you, that will give you information that you need. You have lines that you can call. There are a tremendous number of resources that we continue to provide you on our GroupMe line. So give us feedback. I am doing this for one reason and one reason only: to help you not have to sift through all the data, give you at a very high level what people are digging in the weeds 24/7 to make this world a better place. So please shout back at me. Let me know if this is helping you, if there's something you need differently from me, or if this in its current format is beneficial as we continue to move forward and monitor COVID-19. Hold your head up. We will get through this. We are in the world. We're not of it, but as good citizens in it, we want to make sure that we are being safer at home and united in prayer in Jesus' name. Until soon, it's your coach and colleague, Dr. Brenda Bowers. Take good care of yourself and remember to wash your hands. Wash them at least 20 seconds. Jesus, I'll never forget what you done for me. Hallelujah, anyhow. Those are some staples that can ensure that when you rinse your hands off, you are as bacterial viral free as you can be. Take care. Love and peace.